Hey everybody, Niko here from Redox. Excited to chat with you about accelerators today. We're going to have Devin with us. So let me see if I can invite Devin onto the screen. It might take me a second to figure out how this works, so bear with me here. There we go. Okay, Devin, if you want to share your screen too. So while Devin's getting on here, quick introduction. I'm co-founder, president of the company. Throughout Redox's history, we've participated in many accelerators. So we're going to be talking through our experiences through these various accelerators, getting specific on the ones that we were in, what we loved about them, where we thought that they that we could have done better with those programs, what some of the key takeaways were that we had through that experience, and kind of how all that went. So that's kind of the journey that we're going to go on today. Devin, you having troubles here? Are you able to get in? I think I invited him. Let's see if we can get this to go here. Let's give him one more second. This Crowdcast updated their UI, and now it's crazy. Okay, should have got another invite there, Devin. So I can do a little quick intro for Devin also. I actually met Devin while we were working at Epic back in, 2013, 2012 time period. So we worked together to, oh, there he is. Hey, buddy.
Oh, it's on.
Can you hear me? Can I hear you? Can you hear me? Okay, cool. I can hear you. Okay, awesome. Devin, why don't you intro yourself, and then we'll hop into the accelerator fun.
Sure. I'm the Chief Customer Officer. I work with a lot of our partners to get through their integration strategy. I have a great team that helps with the deployments and customer support. And I'm calling in from Boston because it's 75 degrees. I shared an Uber today with two folks that were going to the beach, which has never happened to me in Boston before. I used to live in Los Angeles, so we had a long conversation about how Boston beaches compare to LA beaches. It was a short Uber ride. So.
Nice. So at Redox, we have a pretty distributed team, and getting involved in the different communities around the country has been really important to us. And that's actually part of the accelerator strategy that we've taken on as part of kind of our marketing and who we are as a company. In general, before we jump into kind of talking about specific accelerators that we went through, I wanted to just kind of cover what an accelerator is. In a traditional sense, Devin's putting on swag too. Accelerator started, maybe about a decade ago now with Techstars, with YC, Y Combinator, and they're really focused around how can some organization work with some very early stage startups to accelerate their growth, right? Typically, they had an investment motivation around that. So the actual accelerator would have a fund that they partner with or be a fund themselves and put money into the companies at the beginning, and maybe put more money in at the end of the program. But throughout the couple months or 3-month program, they all had kind of different lengths that they were associated with. The idea was, can they accelerate the growth of that company such that their investment up front is much more valuable by the investment at the end of the program. So that's where the accelerators kind of originated from. What's happened in the healthcare space is that we've realized that 3 months is definitely not long enough to get a company to market within the digital health world. The sales cycles within healthcare typically take much longer than that. We typically quote 12 to 18 months for a sales cycle in health systems. It was quite clear in the healthcare world that an accelerator model, it was very difficult to move a company from 0 to more than 0 within that 3-month time period, enough to justify the traditional accelerator model. So we had early healthcare accelerators like Blueprint, like Rock Health, like Dreamit Health come to market and basically have the traditional Techstars model and apply it in the healthcare world. But what they started seeing was that wasn't, they weren't able to do that fast enough. So we saw the model start to shift. And we're going to talk about the accelerators that we've gone through and how that model has shifted over time. But essentially what happened was instead of an accelerator being the mechanism to accelerate a startup from 0 to 1 to get them off the ground and running, what happened was accelerators turned into the mechanism for a health system to look and evaluate the innovation market out there. So a health system would partner with an accelerator to say, show me all the great digital health startups out there and which ones I should care about, and basically use that as a deal flow mechanism for the health system to develop relationships with the startups, to figure out who they can trust, to figure out who they can bring into their organization and be more efficient with. So we saw a lot of that through the accelerators that we were part of.
So Niko, I would take that one step further, and I would say for those of us that are looking at accelerators across the board, a year ago or 2 years ago, you would have looked at like their actual fund that they have to invest in as a primary like barometer for how strong of a program it is. Now, I think you can look at their network and their portfolio of relationships. You can look at how many investors they have on their website that are primary contributors and mentors. You can see the portfolio companies. It's become this network of support that outweighs the money that you can collect or that you want to raise from the accelerators directly.
Yeah. So that's a really good point. I think another big shift that happened over the past few years with these accelerators is that they went from that investment model to really more of a community-oriented model. So in the chat, we have some folks calling in from Matter in Chicago, which Matter emerged well after the sort of accelerator bubble that we saw, and it really emerged to be a center of the community to try to attract the healthcare startups within the Chicago area and bring them into one location. And that location they can share ideas in, they can share access to the health systems in the region, access to investors who want to come there. They can have networking events. Redox has put on a few events there. So it's things like that that have kind of emerged out of this innovation space in healthcare that as a digital health company, you should absolutely be thinking about how to take advantage of. So that being said, let's launch into kind of the Redox story and how we've used accelerators over the years. Both Devin and I have found ourselves awkwardly living in various cities around the country throughout this process.
Overstaying our welcome at various Airbnbs and friends' couches in most major cities.
So we're going to run through the, at least five different accelerators that we've gone through, the ups and downs of them, what that journey was like. And it started really back, and actually our first accelerator that we went through was Dreamit Health in Baltimore in conjunction with Johns Hopkins. And actually before that, we applied to Rock Health. So this was probably my first introduction to the accelerator world as we applied to Rock Health. We got through the application process, we got into the on-site visit with like the final 20 companies or so, and went out to San Francisco, met a bunch of really, really great companies that were doing amazing things in healthcare, and actually developed some really good relationships with some of those other companies. One of our early customers, CareVive, we actually met at this late interview as part of Rock Health. And that relationship with CareVive was so good that we thought we should actually reach out to other healthcare accelerators because we're going to find people to work with. We're going to find people to collaborate with. And with Redox, as you guys know, we work with a lot of startups out there and helping them integrate with health systems. And CareVive was one of those groups early on that really bought into that and became a great partner. And now we're live with supporting CareVive integrations across the country. So it was that experience with Rock Health that made us reach out to other accelerators. And that's where I got hooked up with Dreamit. So we submitted our application to Dreamit. And basically what we're trying to figure out, do they have other companies there that are interesting? Who are their partnerships with? And they convinced us to work with them because they had really close partnerships with Penn, University of Pennsylvania in Philadelphia, as well as close partnerships with Johns Hopkins in Baltimore. And the upcoming program that they had, this was in January of 2015, was in Baltimore with Johns Hopkins. So we knew that going into the program, we would be taking investment both from the Dreamit Fund as well as from Johns Hopkins. So that's where Johns Hopkins actually became an investor of Redox. We knew that we would form a tight relationship with Johns Hopkins through that investment and through the accelerator program. And we were early enough in the company where we knew sequestering ourselves or secluding ourselves to the East Coast to really hunker down and focus would be a good thing for us. So the Dreamit business model was very much aligned with the traditional accelerator business model, where they make an investment for some equity up front, and work with you over the 3-month time period to see if they can accelerate your business. So coming out the backside of it, that investment would already be worth more. Yeah, so we literally picked up our stuff, packed it in my car, and we drove across the country to Baltimore and got an apartment right next to the accelerator space, which was an empty apartment that we packed with air mattresses. And that's where we lived for 3 months. A
lot of bonding.
I would say that the biggest benefits we got from that program, especially being so early in our company at this time, we had, at the same time we joined Dreamit, we had closed our angel round of investment. So we raised $350,000. That allowed us to expand the team to 6 people. So we had the Devin and I, Luke and James, TC and Nick, 6 people, 3 developers, 3 non-developers, trying to figure out how to make this thing work. We didn't have customers. We didn't have any live implementations, obviously. We were very much trying to figure out if we had product market fit. And so bringing the crew together, moving to Baltimore, was a big part of that story, where we didn't know if we were selling to startups, to vendors in the space who needed to integrate, or if we were selling to health systems. That was very much a question that was up in the air at this time. So one of the first things that we did during the program was try to figure out if we could develop relationships with Johns Hopkins and with Penn, so we can determine if we could sell to them or not. The program gave us access to the right people at those organizations. We met with the CIO and CMIOs of both health systems, threw our products at them, and got really great feedback on them. And I think that was a huge, that feedback was really important at that early stage of the company to help us determine what it would take to actually sell to a health system. Do you want to add anything there, Devin?
Yeah, I think to me, the programs that we're going to talk about in all these accelerators are going to start sounding a lot the same. And I think when you look at the content that a lot of accelerators have, they do have a lot of similarities. Everyone's going to have a value canvas. Everyone's going to have product market fit. Everyone's going to have a little legal dribbled in, some contracting recommendations. I think what we got out of Dreamit was really, for the first time, we're all sequestered together, and we're being asked some pretty tough questions by some mentors that we trusted. There were 2 or 3 people that met with us weekly and asked us really tough questions that prepared us for what would eventually become an investor roadshow. I know that none of you on this webinar could imagine a time when Niko was nervous presenting, but if you can imagine preparing for Dreamit Demo Day and watching Niko, really for the only time in his life, practice that pitch like 150 times. I think it's the only time he's had to practice something 150 times, but it showed that there really was this fear in our hearts that we were like, we need to impress and we need to get polished. And I think if you're planning on an accelerator, you should plan to look more polished as a company coming out of the program than you did when you started. Dreamit was definitely that for us. We came out with a better brand. We came out with a stronger message, much more succinct. And that we got that messaging because we got asked some really tough questions by people that we trusted over the course of the program.
I think the thing that really drove that at Dreamit was they had a weekly meeting. They called it the board meeting between the Dreamit kind of staff.
Which we totally thought we were cool having board meetings back then. That was legit. Fake board meeting.
Yeah, it was the Dreamit staff and our team. And every board meeting, the first question was, what does Redox do? And then they just poked holes in how we answered that question. Because if you guys know anything about what Redox does, it's complicated. It's infrastructure. It's behind the scenes. It's hard to explain in a concise sentence, but they asked us every single time. And towards the last month of the program, this was January to April, the conversation really started shifting around what are we going to get on stage and present at the end of this, such that we can show that we've made progress. And one of the things I really loved about what Dreamit did, and I think Dreamit is still doing this, is instead of having a huge, $50,000 party at the end where they invite everyone there and, they do this huge demo day, what they did instead was they set up meetings for us with investors across the country. So we had a demo day, it had booze, it was fun. It wasn't a huge party though. It was kind of the Baltimore community. And then what they did was they took us out and brought us to Boston, brought us to New York, brought us to the Bay Area, to San Francisco, and we met with investors. And so we took our presentation that we had honed for that we did 2 months of working on product market fit, found some progress. We did a month of honing that presentation and really telling the story in a compelling way where we can say what the problem is, make it feel painful, say how our solution was the absolute right thing for the industry, and the progress that backs up that validation of the solution. Packaging it up into a presentation, and they brought us into front of investors. They used their own social capital to get us to meetings with investors. Probably had 30 meetings over the next 2 weeks after Dreamit with investors. Those 30 meetings introduced us to probably 10 investors who wanted to have follow-up meetings with us. Those 10 investors whittled down to the few investors that actually stayed through that process. And in our A round of investment that we had closed, we closed 8 months after we got out of Dreamit, 406 Ventures and Flybridge, 2 investors that came in on our A round, we actually met through that investor roadshow that Dreamit put on for us. So they introduced us to the investors that ultimately invested in our product. They used our social capital to help us get those meetings, and they used their experience to help us hone our pitch.
Again, strength of the network, more than just the size of the check that they were able to cut.
Yep. And for them, the investment worked out because they invested in us at the beginning of the program, and then they saw that investment or they saw the value of our company grow by the time we raised our A round 10 months later. And they were a big part of giving us what we needed to actually get to that point. Yeah, so that's before we move on from Dreamit, Devin, do you have anything else you wanted to kind of add about that experience?
Just that Dreamit as a program is still really vibrant. They've made a lot of changes. You should check out their Philly site. We'll put some contact information out after the webinar. So if you want to reach out to someone at Dreamit, we can help you connect with that. But great program. Definitely recommend it. After Dreamit, we pretty much immediately packed up our clunker of a car and drove to Houston, and that's where we want to take our journey next. So pretty shortly after finishing Dreamit, we were contacted by the Texas Medical Center's new accelerator program. They had yet to start a cohort. We were their first cohort, and they asked us to apply. We didn't really know what they were about, but what attracted us to them is that they were in Houston. And if you're new to the healthcare space, you should know that Houston is the highest density of health systems in the country, 23, 25. Someone from TMC is probably going to factcheck.com me after this webinar, but I think it's like 23 health systems share a zip code in Houston. They're all independent, fiercely, most of them, but they collaborate at a ton of levels. And one of them is they are like in this megaplex of healthcare. So groups like MD Anderson and Baylor College of Medicine, Texas Children's, Memorial Hermann, Harris Health, just a long list of like big reputable health systems. And they come together under this Texas Medical Center umbrella, and that umbrella decided to start an accelerator. And in 2015, summer 2015 is when they had their first cohort. And we went out there and got an apartment, moved down there. Niko did the pitch routine, and we started really contacting and refining our pitch yet again. Now more confident that we could sell both to applications, partners, software vendors, as well as health systems. And we, again, tried to take the show on the road, met with a lot of health systems, got a lot of feedback. What was awesome about TMCx is their network was where Dreamit was a lot of investors and a few very influential health systems. TMCx had a broad breadth of health systems, and that was really the network that we were looking to tap into. And they came through. I think one big learning is that I get asked all the time, like, I'm joining an accelerator so that I can get a contract with a health system. And these accelerators can do a lot to put you in a position to make a good pitch and to develop the relationships, but they're not serving up contracts on a plate. And that was something we learned at TMCx. We learned that just because an accelerator, and we learned that somewhat at Dreamit too, but we saw it play out many, many times where really influential and supportive people hear your pitch, have positive feedback, and then it's up to you to hustle that relationship and work through all that it takes to get that deal closed. And I think that really put in new perspective for us what an accelerator can do in terms of contacts and network, as opposed to if I join this, every health system that's affiliated with that accelerator I have an inside track. you have an inside track to pitch your idea, and you have an inside track to relationships, but you don't have an inside track to a contract. And we had to hustle. And I think we learned how to hustle within the health system space while we were in Houston.
Yeah.
Tons of meetings over and over again, repeat meetings. I think that's when we first decided that we did 21st dates with one health system down there. I felt like we were just networked to every individual. But it was awesome.
Yeah, and I think that's a really good point. And something we're going to recap the kind of key takeaways, but the accelerator is about relationships. They're going to throw lots of content at you. They're going to make you sit through, lean startup workshops and business model canvas things and all that sort of stuff, which is great, right? Like as a startup, as a founder, as an entrepreneur, you're always learning. You're always trying to figure out how to do it better. Going back to basics I still go back to the business model canvas all the time to figure out, we're bringing a new product to market. We're trying to think about something differently. Like going back to basics is always great. So go through the motions, do the activities with them, try to learn from them. But at the end of the day, you show up to build the relationships with the people who run the accelerator and the relationships that they are the gateway to. And that's the health systems that are supporting that accelerator. That's the investors that are supporting that accelerator. So TMC was actually a 9-month program. We ended in September of that year. Devin did a demo day. You'll see in the Charlie threw his pitch in there. So if you want to check it out on YouTube, you can see it.
I was scared to death. I did what Niko did in Baltimore. I rehearsed it like 150 times, like all day, just like running through my script. You can tell I was a little nervous. Come a long way.
Oh, but the other thing I want to say about TMC, Texas Medical Center, huge conglomeration of all these hospitals under this umbrella. They are phenomenal at bringing those people together. So throughout that program, they put us in front of different stakeholders in those health systems, probably at least half a dozen times, where we got up on stage and pitched. Everyone had a drink in their hand. Everyone was eating food. They threw amazing events to get our name out there. So that was a phenomenal value add from them. Their business model it still is to this day a non-equity business model. You join Texas Medical Center because they want to bring the best software in healthcare in the country to Texas, to Houston, and they evaluate you based on, not only if they think that you are kind of the leading edge, but also if the health systems that they're working with are interested in it. So they have a committee of stakeholders at the health systems who review the applications. And so by going there, they're really putting their hand out, asking for you to come in and put your best foot forward. Because you're not giving any equity up, it seems like, yeah, might as well just apply. But honestly, like if you get into the program, you got to show up. You got to show up and build that relationship. Otherwise, it's not going to be worth it for you, and it's not going to be worth it for them either.
Across the board of all the accelerators, I would say half of the participants are absentee, just in the room doing their own work, and they're not really taking advantage of the program. And I can't say that was never us or never me in those meetings, because some of it is redundant. But exactly what Niko said, it was really effective for us 6-month increments, essentially at the beginning of the company, to take a step back and revalue canvas yourself and remarket fit yourself. And it just so happened that the week they had the IP attorney come in was the week that we started thinking about our IP policies and how we were going to start structuring that. And just, if you're involved, you start to get those questions answered before it's a crisis. And I feel like with TMC, because a lot of people were from out of town, most of us were not from Houston. There was a group of people that really took advantage of the program, and then there were others that were just on remote assignment doing their own work. So definitely something to keep in mind there. Eric Halverson's the director of the accelerator now, does a great job. I slacked a link on where to apply. I think their applications are closed for this next cohort, but they now have split to do when we were there, it was all one. There were 22 companies, which is a large cohort. Now they've split it where they do a digital health and then they do a device. So depending on how your product falls, you'll want to look at which cohort is applicable. They're a little shorter now, and they do like 2 or 3 a year. So you're never too far away from being able to apply. I think it's a great move because when you're in this program, like Niko said, it was long. When we're not really a device company, so every time people came in to talk about FDA and all the different processes around that, we started to feel a little bit distant. It's hard to pick a long program with content that appeals to both groups. So I think that's something that they do better than most, I think, is pretty much target your content to the type of companies. When we were going through for the first time, or part of their first cohort, they were on the fence on, I think, how they were going to break it down, whether it was going to be consumer facing, provider facing, whether it was going to be a lot of different options. I think the way they picked it was great. Device and digital health. The cohorts that are coming through are really, have really homogenous needs. And so their content's really specialized now.
So we talked about Dreamit, which is kind of a very traditional style 3-month accelerator program. Then we moved on to Texas Medical Center, which was totally a new experimental style program supported by the health systems within a community. After that, we moved on to yet another version of an accelerator. This was brought to us by Healthbox, which started as more of a traditional accelerator, but has since kind of evolved into all different sorts of programmings. And the program that we went through with Healthbox was called their Studio program. And essentially what this is, and they run studio programs around the country with different health systems, but what they do is they partner directly up with a specific health system. Healthbox as the accelerator, the health system as the people looking for innovative products out there. And then they bring a select number of companies. There was a very small cohort that we did with Healthbox.
10 companies.
10 companies to that health system. And basically it was meant to be a remote program where we showed up for 2 or 3 days at a time for 4 times throughout the program. And during those sessions, we got to meet with the various stakeholders. So the studio program that we did was in Salt Lake City with Intermountain Healthcare. So a huge health system within the kind of just off the coast region of our country, Utah, Idaho.
It's west of the Mississippi. So for some people on the call, like it extends beyond,
yeah,
the crossroads of the West.
But you know, obviously, huge health system. They're very forward thinking from a technology perspective. They wanted to see what startups had in the country, so they worked with Healthbox to bring that studio program there. So as you can see, this program, their business model was Intermountain partners with Healthbox to look at digital health companies. So this isn't about helping those companies raise money. This isn't about helping those companies kind of within a region. It's really about helping Intermountain look at the innovation space. And for the companies, for our sake, we were all there because we want to develop relationships with Intermountain. Yeah.
So a couple things that were good about that program. Like Niko said, Intermountain was on the selection committee for the cohort. So there was a closer tie to the health system than we saw at Dreamit and TMCx, where they picked companies and then introduced us to health systems. In this case, Healthbox is almost was a facilitator to Intermountain strategic goals and how they picked companies, which was a new and awesome experience. The program was every Thursday and Friday, every other week for 4 sessions. So it was like 8 days total. Had a lot of presentations, but the thing that was really awesome is they paired you with 6 mentors each session. So each 2-day session, you had 6 mentors, and you would have half-hour round-robin meetings, 3 a day, where you would pitch and find out. They would ask questions about your product. A lot of those folks were from Intermountain. A lot of them were for investors. And again, exposing you to a broad breadth of people and then relying on you to hustle. After every mentor meeting, my invite was, can I schedule some time to dive into more detail with you? And most of them said yes. So it was basically starting those conversations. Intermountain was, they also had some internal intrapreneurs, is that what they call them? Right? Basically Intermountain employees that had pitched ideas and Intermountain had selected, and they were kind of part of the cohort, which was fun to kind of rub shoulders with kind of folks that were in their day job, had great ideas, and were able to refine that idea to a point where Intermountain was willing to throw some resources their way. So a great program. It was really convenient to not have to move somewhere. For us, we're now a 2-year-old company, so moving part of the company to a new location temporarily wasn't quite as exciting as it was early on. This was a lot more conducive, and as a result, the maturity of the companies that we saw were a little higher. We had few more groups that had a couple customers, were had revenue coming in, and so the types of conversations that we saw from that were a little more aligned to where we felt like we were as a company. So again, going back to scope out the portfolio companies, Healthbox has a really strong network of like, once you're part of the program, I talk to people that have a Healthbox connection all the time, and it's like a meaningful kind of fraternal connection that we have. So and they do that because they've been able to network across companies that aren't just startups, they're also kind of mid-tier now.
Devin, what would you say was the defining factor of our admittance into Healthbox?
The defining factor in our admittance into it?
I took the question out of the chat here.
I think that part of it, if you don't know who Todd Dunn is the head of innovation at Intermountain. We met Todd, actually, he was a mentor for TMCx. So we met him in Houston. And when we were looking at Healthbox, I gave him a call. I think Niko and I both called him together and said, hey, tell us what this program is. It's a little bit new. How much is it Intermountain? How much is it Healthbox? How is this process going to go? What is Intermountain looking to get out of it? He was able to kind of help us understand kind of the vision for it and made us want to apply. And he sat on the selection committee. I think it was also back channel. Oh, I don't know. Back channel. I think I was born at an Intermountain hospital, which I can say because we put it in our press release when we did a strategic partnership with Intermountain. But I spent a lot of time in Salt Lake and had a lot of just connections with people that are in the area. I think there's enough quality accelerators that if you have a connection to the region, that really helps. It helps that you have a network. It's a familiar face, familiar place. So I think for all those reasons, having relationships. When people say inside track, you can't understate the power of relationships. And if you're struggling to move forward in a program, start talking to people that were in the program. And you're not just going to inform yourself about that program, you're also going to increase the likelihood that your company is talked about in the appropriate circles. And I don't think there was anything we did that was special. I think we did hustle though, and I think we really tried to put our best foot forward. We talked to a ton of people, made a lot of cold phone calls. Hey, I saw you've been in Healthbox. We're thinking about joining. Tell me about it. We were kind of relentless, and I think that helped a lot.
Yeah. So I think, obviously the sorts of, when they review your application, if you understand how they're going to review it, you can ask them that up front. They're probably going to be looking for, are you solving a problem that's valuable? Are you solving it in a compelling way? Do you have a team that we think can actually solve that problem? Do you have evidence that shows us that you're on the right track? And does the health systems that we're partnering with, and this is the part that I think that check the box at Healthbox in particular for us, did the health system that we're partnering with feel that problem and agree with the assessment that Healthbox made?
That was huge.
So, when we pitched our interoperability is a huge problem in healthcare, obviously, right? So we have a specific solution to that very big problem. Did Intermountain agree with Healthbox's assessment that we are solving it in a compelling way? And if they agree, then they move you to the next round. If they don't, you're out. And I think that's a lot of what happened. So both at Dreamit with, they had people from Hopkins who were part of the selection committee. With TMC, they had people from the various health systems. They actually had CIOs at different health systems review the applications. These were all places where you're not only being reviewed by the accelerator, but by the potential customer, the health system themselves. So your application into these programs is definitely about your pitch. And then obviously, if you can, try to, I called it back channeling earlier, but use the relationships, talk to the accelerator, people who run the accelerator, build a relationship with them, because when they're reviewing your application, they're going to think about that relationship that you have with them. The other thing is ask them to put you in contact with their alumni. Mm-hmm. So all of these programs have alumni now. They put us in contact with people who are thinking about applying. We're happy to talk through that. But also, if you can impress the alumni, they can always put in a good word, right? Like sometimes I'll reach out to the accelerator and say, hey, talk to this company. I thought they were really great. It's not that my word is going to get anyone into a program, but it is going to help kind of move the needle when they think about all the different factors that they're trying to weigh there. So yeah. The next kind of two, well, so we did Healthbox. To cut the long story short.
Wait, Niko, yeah, we need to round it out though. So we did not close a deal with Intermountain during the course of the program. Again, you're going to see a pattern here. It took us almost a year. Oh, go ahead.
We should also say we did not close a deal with Johns Hopkins. We did not close a deal with any hospitals or health systems in Texas Medical Center. As you can see, we're still very positive on these programs, even though they weren't helping us close deals. We learned a ton. We developed relationships. And Devin, you can continue now.
No, I see. A year after TMCx, we did end up doing an integration with a Texas Medical Center health institution. A year after Healthbox, we have moved forward with strategic partnerships and projects with Intermountain. So I think the learning is that this is seeding the sales cycle with these health systems. This is one of the ways that health systems are looking for innovative technologies, but it doesn't mean that they've already have a check prepared and that they're ready to implement sight unseen. It took a year of follow-up meetings and relationships and 20 more first meetings and 100 second meetings to move forward. And I think, again, one of the big takeaways that we want to express is that a lot of people get bummed out about that. And that just, there's so much else to be excited about these programs. We really did, these programs left a great taste in our mouth, even though we didn't end with a contract in hand. There was a lot of value, and it's continued on, right? It's really a relationship that builds over time.
Yeah. So at Dreamit, when we were a very, very early company, we didn't have a product, didn't have product market fit or anything. We were introduced to executive leadership at Penn. Literally yesterday, I was in Philly meeting with those exact same guys that Dreamit introduced us to. And now we're at a point where it might make sense to actually work together. So it goes to show, like, these relationships build and develop over time. And the thing that we found that these health systems love about the programs is that they meet you really young. And they're going to be there 2 years later, right? 2 years is like a very long time in startup world. But in a health system, like in a CIO's mind, 2 years was like that. Their epic project took them longer than 2 years. Like it's a snap. And so when you go back a couple of years later and you show, hey, you've grown, you've matured, your product is in the market now, they're much more willing to have that conversation with you and open their doors to you and kind of be welcoming. So I want to run through the kind of final two accelerators that, we literally just finished one and we're starting up another one right now. But then we'll summarize some kind of key takeaways. So, so we finished Healthbox. We ended up, after getting more market traction, working with different health systems, we were able to raise another round of investment. That's when Intermountain, through their fund managed by Healthbox, invested in Redox. So they used that as a mechanism to invest in us eventually after the program. So that was great for us to have that strategic partnership with Intermountain now that was started through the Healthbox program. We then went on to we heard about Pulse, which is part of Mass Challenge, which is an accelerator in Boston. Pulse is the healthcare kind of portion of it. And the thing that was really exciting about Pulse was that it was about community. It was about the community in Boston, very much like Texas Medical Center was about the community in Houston. Pulse had kind of buy-in from all the different health systems there. They had buy-in from partners, both Mass General and Brigham, as well as Beth Israel, and just the huge medical center in the Boston area. We love that about them, and obviously the Boston community has a lot of innovation happening in the health tech space. So we wanted to be part of that community. Big reason why we joined Pulse. The Pulse program was pretty interesting. I think that we didn't show up as much as we could have. We probably should have had more people there, but as a scaling company, we just closed our B round. We're heads down trying to get to market in a very big way. We didn't show up as much as we could have, and because of that, the relationships that we developed there were pretty limited to the groups that wanted to talk to us, rather than us being there every day, reaching outward to all the different people who were coming through the door of Pulse. I think that was a missed opportunity for us. Devin, I think you participated in Pulse probably more than I did. What do you have to say about that program?
Well, first, they have applications open right now, and Michelle is. I will Slack her contact information here in a second. I think that I totally agree with Niko. I think we look at the stage of company that we were and are at the. Oh, there's Michelle. Michelle, are you on? Oh, there you go. Michelle, put your contact information in the Slack so I don't have to look it up in my email. I think the thing with Pulse is when you look at the size of company that we are and that we were at the time, we were less in a position to like be remote and participate in the content. We went out for all the required networking events and obviously the demo day and mentor meetups and whatnot. But I think what we felt is that we didn't move someone to Boston. We flew in for specific events, and we became essentially those absentee participants that we had seen at our other accelerators. Now, it wasn't an accident. Like, we wish that we could have done more. But I think we definitely felt at the end that we had a core group of really good friends and contacts, but it felt different for us. And I think now we can say that we've been on both sides. If we're going to do a program, you have to be able to commit the time and be on location. You have to have boots on the ground, not just for brief moments in time. Like, you have to like commit to the program, and if you do that, there's a ton of value. But I think we have several really strong relationships. Boston is a great hub for us, and we get out here as often as we can. Some great partnerships. Niko mentioned 406, our one of our early investors based here. So I feel like we have a home base in Boston, but we definitely could have had boots on the ground more at Pulse. And we would definitely recommend it for anyone that has Boston as a target hub for their company. You should definitely get connected. Great connections into the health tech space. And Boston has deep roots in health tech. And I think Pulse is definitely instrumental in helping expose that.
So I think one of the things that, on the counter side of that, we entered Pulse probably 2 years after we entered Dreamit. So we're a very much more mature company than we were in our first program. So that caused us to not show up as much as we had in past programs that we did. But the thing that changed about it was when we met with the mentors, when we met with the health systems, when we met with the other companies that were there, we had answers. We had much better answers to those questions. And because of that, we were able to take advantage of some of those relationships that Pulse put in front of us better than we would have had, back when we were doing programs 2 years earlier. So through Pulse, we met a lot of great health systems within the Boston area that developed some relationships. And we actually started working pretty closely with one of those health systems that we met through the program. So although we were more absentee and didn't take as much advantage of it as we could, we actually got some real ROI benefit from doing the program, more direct ROI from the program than we did from any other program that we did. The other programs brought us into a community. They built relationships. Those relationships turned out to be beneficial over time. But what Pulse did, because we were a later stage company, we were able to take advantage of the relationships much faster. So we are now working with a couple of the other companies that went through Pulse with us, as well as some of the health systems that were part of the program and helped to support the program. Again, Pulse's business model is a non-equity business model. So they're not going to take equity from you to join the program. They're not going to charge you to be part of the program. What they want you to do is show up, be part of their community, and work with the health systems that help to support that program. And that's what's going to get you the most benefit, as well as them being, that kind of hub and tip of the spear for that Boston community.
One other thing that's unique about Pulse is that they align. They call them sponsors. Big companies that are part. They may have to pay to be a sponsor, but I don't know. They call them sponsors. Big companies that when you do your early pitches, they whittle the field down, and then you pitch in front of these sponsors, and sponsors will basically say, "Yes, I want this startup to be in the program." So our sponsors were Humana and Microsoft. They're two of dozens of groups that voted on Redox essentially and said, I want to sponsor Redox through the program. And we set up goals with those two organizations through the program to say, here's what we want to do with Microsoft. Here's what Microsoft wants to do with us over the program. And it was also fun because Microsoft and Humana both had other companies that they were sponsoring. So within a cohort, we kind of had a smaller cohort too. We had a Microsoft cohort and we had a Humana cohort. And those two relationships have definitely carried on too. So Niko mentioned some really exciting health system contacts that we had. We met some great portfolio companies, other startups that were in the program, and we've also developed great relationships with those sponsors. So I think definitely more legit ROI faster. I think that's more a function of us being able to realize that ROI faster than the program. I think any later stage company going through an accelerator is going to have that. But yeah, that's definitely something unique with Pulse that I really liked, was the fact that they had big companies that had dedicated people that were pseudo part of the program to help be sponsors of smaller companies.
Yeah, and then just the last program that I want to touch on, we just actually started with Prime in Denver. So this is Prime Health, and we really saw them as bringing the Denver community together. So there's a lot of health systems in that area, a lot of innovation happening, a lot of investors, and we didn't have a pulse on their community. And so again, we joined that because we wanted to figure out what's going on in Denver. So literally we've only done one thing with them so far, but their program is very different. So I don't even think they call it an accelerator, but what they do is they bring companies in and essentially whittle those companies down throughout the program. So right now there's, I think, 12 of us, and then there's going to be 6, and then at the end there's going to be 4. The 4 companies left at the end of this thing will have pilots with the health systems in that area. And Prime, and through their sponsorships, actually puts money into those pilots. And that money goes both to the company as well as to the health system. Because one thing that is kind of hard for an entrepreneur to hear is that when a health system chooses to pilot your product, they actually go at risk, right? Your product might not work. It might not work in the long run, and it'll actually cost them a lot of time and effort to do that pilot with you and give you the feedback necessary to make your product better. So a health system choosing to do a pilot with a startup is quite risky and expensive for them. So what Prime does is actually gives the health system and the startup, and you have to figure it out with your budget for the pilot. They give them something like between 45 and 50 grand to pay for the IT resources to set up your product, to pay for your time to come out there and actually get the feedback from piloting at this health system that you need to take on the road and justify using your product elsewhere. So interesting kind of model that they have in Denver, and I'm excited to see how it unfolds. I just went out there to do like a mentor round, so got feedback from all the mentors. The next round is going to be with the health systems, who are going to be determining if they want to move to the next stage to consider for the pilot. So it's kind of a condensed kind of pilot life cycle within a community, almost like an accelerator.
Kind of like Hunger Games.
Kind of like Hunger Games, yeah. I got the backpack and the sword, so I feel like I'm doing well. Yeah. Okay, so some key takeaways to wrap it up. I wrote down a few as we've been talking to Devin. You might have some others, but the first one, if you join in one of these programs, like show up, like get there, get your team there, go to the events, go to the lectures, and be ready to learn, like be open. Even if you've already figured out a lot of things with your product, even if you're already in the market, even if you're already selling, you can always learn more and always learn from the different perspectives. The health systems that they're associated with are different than the health systems that are your customers, and so they're going to have different things to teach you. So show up, learn. The other kind of key takeaway is these programs are about relationships. So build relationships with the community that you're part of. It gives you a really interesting insight into how that community works, who the players are in that community, who the influencers are. So use that opportunity to build those relationships. You know, it's not just about going to the organized functions that the accelerator puts on. Go outside of that bubble, ask for introductions, meet other people in that community because you're there anyways. So that's where the hustle comes in, because those relationships, as we've talked to you guys about, pay off in the long run. So two years down the line, you might be able to reuse that relationship, go back to them, and actually get a contract out of it. So that's kind of my key takeaways: is show up and be open to learn, use that community and build relationships with that community, because that's what's going to get you business in the long run. What are the other takeaways that you got from this discussion, Devin?
I was going to say hustle, hustle, hustle. So many people in the program and all these programs feel like they are owed something sometimes because they were in the program. That just isn't how it works. So no such thing as a free lunch. Got to hustle. The other thing that we didn't really highlight, but the people that work in startups are some of the most supportive and insightful people because they talk to hundreds of startups all the time. And so, you know, the program managers and the community administrators, and they come in different forms, but you take advantage of their insight. I mean, they literally rub shoulders with hundreds of groups just like you and I, and they're willing to share like trends. How strong is this message? They've heard every pitch. And I feel like we have found both quality friends and quality employees by rubbing shoulders with some of the folks that work in this startup space. They have a high tolerance for change. And the fact that they've been able to scope the market out as thoroughly as they have makes them hugely valuable from a feedback perspective. The other thing that I would say is I legit feel like we have gotten 80% of our value from accelerators out of the portfolio companies and relationships that we've built, not necessarily from the health systems, even though the health systems were the target of just about every program that we started. So I would encourage you to expand your scope of value, how you're assessing value of these accelerators. It's worth the time, especially if you're not just looking at a signed contract cash flow as your value metric. I definitely feel like the Redox brand, the maturity of our product and our company as a whole, we're actually accelerated by sitting down in these programs. And did you see what I did there? Niko loved that. Niko loved that. Going to start a hashtag. So yeah, we would do, I think we would do these programs all again.
Cool. So thanks so much for coming and hanging out with us today. We posted links to the different accelerators that we talked about. We'll try to throw some notes together for a blog post or so in the next couple of days so we can kind of recap on some of this stuff. If you came here to learn about Redox, that was a bummer because we didn't talk about ourselves much at all. So
got a headband and a lapel pin. I mean,
yeah.
It right down.
Check out our website if you're interested in that. We also have a bunch of other recorded webinars on Crowdcast on this platform, so you can go and take a look at some of those if you're interested in learning about what the heck we do. And yeah, if you're planning to accelerate and have specific questions, feel free to reach out. You know, as much as we're trying to grow and heads down in this space, we're still part of the community and we still want to help out. So feel free to reach out. We'd be happy to talk to you guys about it. And they're fun. Have fun in them. So if you go and join, hop in and have a good time. So thanks a lot. I'll throw my email in here too. Cool. Thanks for coming out, guys. Have a good one.
All right.
Now let's figure out how to turn this thing off. There it is.